Hi, this is Dr. Christopher Maloney, naturopathic doctor. I'd like to take a moment to tell you about my own experiences as a patient, because I think it's very important for patients who are looking at doctors to understand where does the doctor come from and how would he treat himself for these diseases. So a number of years back, I had the wisdom to store my hand truck, which is this hand cart that you store boxes on. You see people with UPS using them all the time. A hand truck is a steel plate on the front of a rig where you put the two wheels and that plate was hooked over the top of a roof beam in my garage. So of course, as I was rummaging about, I tapped the handle of that plate. The plate came loose and dropped straight down on my head, so I should be dead. It came down straight on my head. The steel plate, a 50 to 75 pound object coming straight down upon my scalp. And of course, the first thing I thought was, what the heck was that? And the second thing I thought was, oh, darn. And the third thing I thought was, I hope it didn't scrape my skin, right? Because I know that head wounds bleed like crazy. So I reached up, and there was, of course, blood everywhere. So I thought to myself, well, goodness, now I have to do something. Now, if it was any other part of my body, I might have been inspired, because I do know basic stitching myself, to stitch myself up or to use some kind of glue, but it happened to be under my hair, and it also happened to be a head wound, so it was bleeding profusely, so I didn't want to try to do that. Even if I could get to it, I couldn't do it. So I thought to myself, you know what, we've just had the opening of an urgent care facility here. It was actually at the Walmart, and so I thought, what I'll do is I'll drive myself over to the Walmart and get myself stitched up. So I got in the car one-handed, driving one-handed over to the Walmart. Went to the Walmart. Turned out it was 9:47 in the morning, and Walmart urgent care evidently didn't open until 10 a.m. It's since closed, and I understand why, because urgent care doesn't happen between 10 and 4. So I went in, and I actually waited for them to open, sitting there with my head, and they opened, and they said, we don't have any suturing material. I said, well, what kind of urgent care is this? You don't have anything to kind of suture me up? No, you have to go to the emergency room. So again, I got back in the car, drove over to the emergency room with my head, went into the emergency room. Now, it's fairly obvious at this point. My skin is soaked with some blood coming down. Fairly obvious what my injury is and what's happening. So I went into the emergency room, the front desk, and they asked me to fill out the paperwork. And I'm staying there going, well, wait a second, I've got a head wound. You want me to fill out the paper? Oh yeah, fill out the paperwork. So I'm filling out the paperwork one-handed and dripping blood on their paperwork. And then I'm brought in, finally, I sit and wait, and then I'm brought in, and they bring me in, and the nurse is going to take my blood pressure and ask me what's wrong. So I'm me, and I understand there are procedures to follow, and so I go about my merry way, and I go in, and I see the nurse, and she takes my blood pressure, and I said, yeah, I have a head wound, I need to have it stitched up. And about a half an hour later, someone else comes in, and they look at the head wound, and they say, well, you need something for that. And in the process, what happens is that I said, I really need you, well, we're going to shave half your head. And I said, no, I have to go pick up my kids soon. I really don't have time to have half my head shaved. Why don't you just staple it closed and let's go on our merry way. And so they said, okay, we'll do the staples. We'll lidocaine up your head. We'll inject you with a bunch of lidocaine. I don't like a lot of needles in my head. So I said, no, just staple it. I'll be fine. So of course the doctor's wincing as he does this, but I'm just like, just staple. Go away. Oh, it hurts. It's fine. And but once he finished the staple, I realized that he's not going to put any antibiotic ointment on there. I had a rusty thing hit my head. I've been exposed to the hospital setting. I asked him very nicely several times for antibiotic ointment and got it. So I got my ointment, and then I left. And the idea there is, you'd say, well, what does that tell you about me as a doctor? It says that I'm very, very focused on patients rather than doctors. I'm focused on self-care as much as I possibly can. That's what I do personally. You saw I didn't call the ambulance at any point. I probably should have, but I was very much thinking I could do it myself. And when push came to shove, I very much was in charge of the visit. And that's what I want in my patients as well. As you can see, in my situation, that's what I did. That's the kind of person I am. That's the kind of patient I want to see.